The calls to emergency rooms and to doctors are only increasing. Concerned patients who can't really tell the difference between a spring cold and the flu, they want to know whether or not they should be taking Tamiflu as a precaution. And these calls will only increase today with that global alert level that you mentioned now being raised, and the death toll in Mexico now up to as many as 152. And this morning, new information about where all of this might have started. This morning, the Mexican government believes the first victim from this swine flu might have been a 4-year-old boy from Veracruz, where an entire community had been protesting pollution from a large pig farm for some time now. The farm is jointly run by a Mexican company and an American company, Virginia-based Smithfield Foods. The Virginia company maintains it has found no clinical signs or symptoms of the presence of swine influenza in the company's swine herd or employees. Though more samples from that farm are being tested. The boy eventually recovered. Along the U.S.-Mexico border,
are you bringing anything from Mexico today?
Patrols have been stepped up on the lookout for signs of sickness, while overseas airports across Asia have set up sensors that detect a passenger's body heat, whether a traveler has a fever. This man in Hong Kong was approached by a security team after the sensors showed he could be ill. Back home, the White House continues to urge calm.
This is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm.
But patients calling their doctors are not convinced.
The phone has not stopped. The computers has not stopped in terms of questions.
With so much talk of swine flu, for many, it's become difficult to differentiate between a severe spring cold and something more serious. And travelers just returning from Mexico must wait and see.
There's a fear that goes through everybody. I'm monitoring any sort of respiratory symptoms.
This doctor showed us the nearly 200 inquiries during our visit alone, many wondering if they should take Tamiflu as a precaution. The answer, almost always no.
Stay at home, rest, drink lots of fluids, remain hydrated.
For many, the heightened concern brings back memories of the swine flu threat of 1976.
A swine flu epidemic may be coming.
An unprecedented campaign, though the real danger never really surfaced. In this case, the CDC continues to say we are not in the clear.
We don't know how good or bad this situation is because we don't actually know how many people are infected.
And therein lies the problem. We're at 28 cases now here in New York alone, up from 8 just Sunday. And they say the number could rise, doesn't even include the case that you mentioned just up from you in Times Square. And this morning, Robin, the State Department is now officially advising against travel to Mexico. But as you know, many passengers at airports around the country have simply told us they'd changed their flights already on their own.